good morning, everybody. I hope you're all having a great day today, and welcome to our Premier Provider Network webinar. We really have a great webinar in store for you and something a little bit different today than we've done in the past, so you are in store for a great 45 minutes. I'd like to extend a warm welcome to everybody joining us today. This is Ryan Piccarella, President and CEO of Wearables, and really am happy you could all be with us today. Today we have a Premier Provider Network webinar, and these webinars are really a great opportunity to showcase, what some of the latest and most cutting-edge vendors are doing in wellness today. Today's spotlight is on Validic and wearables and wellness. I tell you, this is really a hot trend right now. I just read actually a statistic this morning that 1 in 3 people are now wearing some type of activity device. And these devices have all kinds of applications, and Validic has really been leading the charge and looking how to connect lifestyle and kind of clinical tools for really awareness and to really help wellness programs go to the next level. So we have wearables and wellness providing insights that are impacting lives, and we're going to hear some great stories today about how wearables have been used in different programs and applications in organizations around the country. Before we get started, we've got a few housekeeping details today. If you do have any issues on the phone with scratchiness, you can always switch your audio preferences, so you'll see the control panel there. You can go from your computer audio to your phone audio, so that should help if you do have any issues. Also, we do have the handouts available to you, so those are going to be a PDF, and you'll see those in your main screen kind of halfway down as well. So you can grab those, download those, and have those if you should need those for taking notes or for later in the webinar. If you do have any issues getting disconnected, we do have a team standing by, so we'll be able to help you work through those. So email us at webinars@welcoa.org, and someone will be there to help you work through any challenges that you have. And lastly, we will be taking questions, so if you have any inquiries about today's topic, you can submit those questions to the panelist in the control panel, so you'll see that at the very bottom of the screen as well. So this will be a really dynamic live presentation for you all today, so again, looking forward to getting things moving. All right, without further ado, I would like to introduce Jennifer Plumer. She's the Director of Marketing at Validic, and she is going to be the host and guide for today's webinar. Jennifer has been with Validic for a number of years now and has over 10 years of experience in marketing, and so she's really been kind of leading the charge with the executive team at Validic to introduce wearables to wellness. And so without further ado, Jennifer, I will turn it over to you to take it from there.
Great. Thank you so much, Ryan. Good morning, everyone, and welcome to today's webinar, Wearables and Wellness, providing insights that are impacting lives. As Ryan mentioned, my name is Jennifer Plumer, and I am the Director of Marketing at Validic, and I'll be your moderator for today's webinar. Before we get started, just to provide you some context as to who Validic is, we quickly and easily integrate data from wearables, clinical devices, and consumer apps into our customers' existing programs and systems. And this allows our wellness and payer customers, among many others, the ability to offer a comprehensive bring-your-own-device approach, and allowing them to capitalize on the health data employees are already generating on smartphones, apps, and devices. Validic is thrilled to be the sponsor for today's webinar through WellCoa, and we hope you'll walk away with some helpful information from our speakers. As Ryan mentioned, you can submit questions in the Q&A box at the right of your screen, so we hope you'll do that throughout the presentation today, and then we'll take some of those as we have time at the end. So in today's webinar, we'll hear from 3 of Validic's very innovative customers on how they're utilizing insights from wearable devices to create sustainable behavior change in employees, ultimately helping them live healthier and more productive lives. So joining us from Asset Health, we have Mike Creal, who is the Senior Vice President. We have Jim Pursley, who is the Chief Commercial Officer from Livongo. And lastly, we have Mike Demman, who is the CEO from SimplyWell. So with that, I'll turn it over to our first speaker, Mike Creal from Asset Health.
Terrific, and thank you, Jennifer, for that introduction, and we appreciate everybody's time on the call today. Again, I'm Mike Creal with Asset Health, and we are very excited to have an opportunity to share with you all how our partnership with Validic has been very valuable for us in the wearables data exchange area and helping our clients drive more active engagement for their overall program, certainly their employees, And we see this as certainly a growing area as we kind of continue to develop very robust and administer very robust wellness programming for our clients. So we go to the next slide. I'd like to start with an overview of who we are. We are a corporate wellness administration company located in Troy, Michigan, just north of Detroit. And we have built our business on really offering very configurable, flexible solutions for our clients that focus on driving engagement, focus on foundational education that will drive comprehension and impact intrinsic motivation, which ultimately will impact and drive behavior change. One of the things that we have found in the marketplace in general is that wellness is no longer a check-the-box type activity. Engagement is critical, and measuring engagement and having real results is becoming more and more important, certainly for our clients in the marketplace. We also need, as a provider of these services, a great deal of flexibility in terms of our partners, in this case Validic, in terms of driving the data into our system to make the experience for participants to be robust and effective and fun, engaging, impactful, and again driving that intrinsic motivation that will ultimately impact the behavior change. What we're going to talk about on the next slide is how we have looked at the data from Validic, and there's a number of different ways to take all the wearable device data, and that's obviously voluminous in terms of content. And one of the early ways that we have adopted this data is into our goal tracking platform as well as our wellness challenge platform. I'm going to focus today during our time on the wellness challenge platform, and the opportunity really is how do we have the data help the experience. We have many different types of challenges. We have challenges around overall stress and well-being. We have challenges based on nutrition, hydration, as well as physical activity, and that's where we've really seen the most widely adopted use of the wearable data is in the physical activity. And that comes in either a steps-based or a minutes-based challenge. These challenges can be either individual or team-oriented, sometimes both. At the same time, they generally last 4 to 6 weeks in terms of duration, and offer an opportunity for the individual and their coworkers to really focus on that desired activity. The other thing we've seen is, especially when you're talking about a steps challenge, is a movement in the marketplace from even a few years ago where people were handing out pedometers and saying, track your steps and then log into this portal and report how many steps. It's become cumbersome, and when you have to remember to go do something like that, it really takes the eye off the ball, so to speak, for that participant and makes it less engaging, less enjoyable as they go through that process. We have used the wearable data that we have from Validic to really drive more active engagement and participation, make it fun, and you'll see as we come up here towards the end of my discussion some really favorable feedback in terms of how effective that has been. We will continue to examine other ways to integrate the data in, and we'll kind of focus on this at this point. So using a couple real-life client examples to share with you what the impact has been, I'm going to focus on a health system client of ours as well as a utilities provider, both rather large clients in terms of number of employees. I'll start with a health system client. There's a little bit of history here. They have 24,000 employees, geographically located in a consistent area in a metro region. And they had previously had a program that had very limited data integration. There was a lot of manual intervention, and the challenges hadn't received a lot of uptick in terms of utilization. They got a little bit stale, and we worked with them to do a couple different things. Number one, on our portal, we coordinated a partnership with Fitbit so where individuals could sponsor or order a subsidized Fitbit, and the organization subsidized the cost of that. And that helped certainly drive a lot of the activity. They had over 35% overall participation end-to-end in terms of the actual challenge. This was a 3-week challenge. It was done over the summer. And the other thing we've done with them is they integrated it within their overall program structure, which really focuses each quarter on physical activity, education, and then relative engagement and community volunteering and kind of the social wellness. Participation came up, and more importantly, we found that 20% of the participants who completed the challenge never in fact logged in to report the data. So 20% were able to really focus on their activity as opposed to the mechanical process of reporting. The utility provider, about 29,000 employees, a little bit more, had a 6-week steps challenge, and they actually run this twice a year. And they really did focus also on having a sponsor with, in this case also was Fitbit, so there's a subsidy there. And so we saw a high level of participation using that specific device. We're agnostic, and we really, one of the things we love about Validic is it gives us that flexibility no matter what device people have to be able to do that. This is also a very diverse population, so you have union, non-union, you have professional, blue collar. We had over 36% participation, and 75% of them actually used the Fitbit to track, which is up, dramatically over prior years. And again, 3 years ago, they never had any wearables tied into this. And again, we had 22% of the participants really being able to complete the challenge without having to log in very frequently, less than 3 times in this case. So as you can see with those specific results, we've seen the opportunity to keep the focus on the activity instead of the reporting. If we go to the next slide, this is some of the participant feedback just to share real life information. We do surveys at the end of each challenge, and when you see these things, I won't read them all to you, but just to point out a few. The first one, great way to get motivated. It was easy to do without me having to track daily steps or remembering to log them in the system. We're all so busy. How do we try to tie that? I love, love, love this program. It says, you don't have to read any further from there. And then even fourth from the bottom, while enrolled, I was motivated to exercise more frequently. In addition, I found myself taking multiple walks every day while at home. So that's the type of feedback we'd love to see. And clearly the integration within the wearable devices and the data that comes from that is we've seen some pretty important impact immediately, and we'll see that as we continue down this path and in other ways as we kind of further deeply integrate it into our platform. So that is an overview of how Asset Health has been able to provide the integration. And we, again, very much appreciate our partnership with Validic in this area.
Great. Thank you so much, Mike. That was very interesting. Up next, we have Jim Pursley from Livongo, and he's going to share with you how employers are using their disease management platform and employer wellness programs.
Great. Thank you so much, Jennifer. So I'm going to just move very quickly through an overview of the landscape. I think many folks on the line today are intimately familiar with some of this information, but if you move on to the next slide, a lot of times folks will ask us why focus first on diabetes, and the answer is similar to what the famous bank robber Willie Sutton once said when asked why he robs banks. His response is, that's where the money is. If we look at the chronic condition landscape today and we look at the prevalence of diabetes, almost 10% of adults living in the U.S. have a diagnosis of diabetes. And you look at the impact of diabetes, both on quality of life, things like missed days of work, but also the cost on folks tasked with paying for diabetes, whether it's an employer or a health plan. If you look at the prevalence and the impact of diabetes, there's few places where you could start and have more of an impact. So we're focused predominantly on diabetes, but have a broader vision to empower people living with chronic conditions to live healthier lives, but starting with diabetes. So next slide. So a couple quick dynamics I'll just touch on and then get to the results we're having and the way that we're using integrations through folks like Validic and real-time data to impact people living with diabetes. But the challenge with chronic conditions, and this is the opportunity for all of us on the line here, is that even if somebody is seeing a physician, let's say 5 hours a year, that would be more than 95% of people in the U.S. Get to see a physician for that period of time. Even if you saw them 5 hours a year, that still means that 99.9% of the time you're on your own to figure out how to manage your chronic condition. And so it's a huge opportunity for us to come alongside of individuals with better technology, smarter technology, to support them and empower them that 99.9% of the time. Next slide. And not only are they on their own, but if you know anybody, and with 1 out of 10 adults living with diabetes today, the chances of all of us on the line here knowing somebody living with the disease is pretty good. But if you know anybody, diabetes is also an incredibly difficult disease in the sense of it puts a lot of burden on the individual. So there's a lot of challenges, everything from procuring supplies, things like test strips, the cost of test strips. It's one of the single biggest barriers to good self-management is simply the cost of supplies and medication. We ask folks to do a lot. We ask them to write down their blood glucose readings in a log book. We ask them to write down what they ate, what time of day it is, etc., how they feel. And then healthcare providers are frustrated as well. At best case, somebody does all that and they get a log book full of raw data, and they have about 7 minutes in their visit to try to interpret that and make some meaningful use of that. So people living with the disease are frustrated. People caring for those individuals, providers, are frustrated. And then employers and payers and those folks who are tasked with paying for them are frustrated. So this is the opportunity that we're presented with at Livongo, and that's what we've walked into to hopefully make a significant impact on everybody, both living with the disease and caring for those who have it. So next slide. So what we are, what Livongo is a consumer digital health company. I mentioned that we're focused on really reinventing the way chronic conditions are managed, and we're starting first with diabetes. And we believe very much that it's not just a technology problem, but it's a consumer experience problem. If you think about how Amazon has transformed retail, how Uber has transformed transportation, even something as simple as online banking through Bank of America or Wells Fargo, the experience that we've come to expect has largely been absent from healthcare. And I say to folks, if it was as difficult to order a book on Amazon as it was to understand my explanation of benefits or to reorder supplies, Borders would still be in business today. And yet that's what we've put on the shoulders of our employees, of our patients, of our members. We still treat them like patients and not like health consumers. So by using technology, if you go to the next slide, elegantly applied to the problem, we think we've been able to reorient the entire consumer experience, leading to much higher levels of engagement, leading to better clinical outcomes, and ultimately better cost outcomes. And I'll share those with you here briefly. So the Livongo solution includes, first and foremost, a connected cellular-enabled glucose meter. So we're able to get data from our meter when somebody checks their blood glucose to our analytics platform in the cloud in real time with no additional technology. So again, we talk about reducing friction. So whether it's our partnership with Validic and our ability to get real-time activity data into our smart cloud and then correlate that activity data with glucose data to draw more intelligent, clinically sophisticated insights, or whether it's getting blood sugar data from our meter to the cloud without having to Bluetooth sync to a smartphone or USB cable to a laptop, we're able to reduce the friction, leading to much higher adoption rates and engagement rates. So it starts with this meter here on the left-hand side here. We're getting highly accurate real-time information, and we're getting it to our analytics platform. We're taking that information, we're aggregating it with other information, RX information, medical claims information, could be, again, activity data from an activity tracker via our integration through Validic. We're aggregating it, we're analyzing it, and we're synthesizing it into actionable insight, which we're pushing out digitally right back to your meter to a smartphone. And in cases where we see something that we can't correct digitally, a significant high or significant low blood sugar, a certified diabetes educator from Livongo is going to reach out within 3 minutes and engage our member in a discussion. And you'll see here the next slide. Actually, you know what? go back, sorry. What you'll see in a couple of slides is that when we reach out to our membership, we're getting them over 80% of the time because we're doing it in that it's that real time, it's that magic moment where they're holding their meter, they're thinking about their diabetes. That window is going to close again. They're going to go back to being sons and daughters, mothers or fathers, employees, and they're not going to want to get a phone call from a disease management nurse at 6 o'clock in the evening when they're sitting down for dinner, or at 3 o'clock in the afternoon when they're in the middle of a meeting. But we're able to get them in that perfect moment, and that's allowed us to, again, reach them over 80% of the time, deliver content, coaching, education, affect behavior change, and ultimately lead to better clinical outcomes and financial outcomes. So who are we working with? Go ahead. Thank you. We're working with some of the country's largest employers, health plans, and providers in the country. Really anybody who has risk for a large population of people living with diabetes. This is just a very small sample of the organizations that we're working with today. Next slide. And so what you're all interested in, what are the results are we having? So just to touch on the results we're having, first and foremost, of a population of people living with diabetes, roughly 40% will enroll into our program and become active participants. So if you had 1,000 employees living with diabetes, we would expect to see, with no additional incentives, we would expect to see about 40% enroll. And we can drive that number even higher through plan design changes, through other incentives. But we see about 40% participation. We talked about that 80% reach rate. If you think about traditional telephonic disease management, low single-digit reach rates, and we're able to engage our members over 80% of the time. And our members are checking their blood glucose, they're engaging with Livongo over 2 times the national average. And I say the national average, it's a little hard to figure out what the national average is because that data has never existed before. We use things like script refill data, strip reorder data, but that assumes that every single strip that's ever reordered is used. And so this number could be as high as 3 or 4 times the national average. And so folks are excited and coming into the program in large numbers. They're highly engaged, and they're very active in the Livongo program. So next and last slide here, I just want to touch on the results that we're having. This is from a large Fortune 100 client of ours who rolled out Livongo to their entire population of folks living with diabetes, several thousand, spread out across the country. And you can see here, first and foremost, people love Livongo. They have to love it or they won't engage with it. Diabetes is a difficult disease. It's an unpleasant disease. It's not a hobby. It's not your grandchildren. The bar for us is really high. People can't just like it. They have to love it. We have an NPS score, by the way, in the high 50s, and high satisfaction scores in the low 90s. So 91% of this client had a positive experience. 78% feel more confident in managing their diabetes as a result of Livongo. We were able to improve glycemic control. We were able to bring folks into range, so we were able to reduce the numbers of lows and highs, which are really important. So not only are we looking to lower A1C, which is a metric used, hemoglobin A1C, it's a metric used in measuring how somebody's doing managing their diabetes, but we're also able to reduce the variability, reducing the highs and lows, which we know is really important both for quality of life and to reduce things like unplanned ER visits and hospitalizations. And ultimately, the improved glycemic control led to, as well as improved, in this case, we moved the needle as well on things like dyslipidemia or high cholesterol, hypertension. We were able to produce an average medical claims savings. We analyzed claims data pre and post Livongo of over $186 per employee per month. And I will acknowledge this is on the high end of what we see. This is not. I wouldn't say that we would see a saving quite that significant in all situations, but that produced a very conservative 2.5 times ROI in their investment in Livongo. If you back out the cost of supplies, because I forgot to mention we provide unlimited supplies at no cost to your members or your employees. If you back out what you're already spending on supplies, because most of our program is paid for by just a cost reallocation, that ROI can jump up to 3 or 4 times, 3, 4, 5 times ROI. So in any event, I'll wrap up with that. people are loving Livongo. They're using it in a significant way. It's improving over the first 12 months clinical outcomes like glycemic control, and those clinical outcomes are leading to improvements in cost. And we're seeing that not only in this specific case, but across our book of business. So thank you for the opportunity. Thank you to Validic for our partnership and the impact you're having on our members who are working every day to live happier and healthier lives. Thank you.
Thanks so much, Jim. The presentation was really interesting, and we'll move to our last speaker for today, who is Mike Demman from SimplyWell.
Hi, thank you. Good morning, everyone. Thanks to Validic and Welcoa for providing a great opportunity to kind of display how wearables are being used in the market. The next slide just gives you an overview of who we are. We were founded in 1998, actually by physicians, headquartered in Omaha, Nebraska. Like my colleague from Asset Health and Livongo, we partner with employers to really provide a robust health management program. And our partnership with Validic goes back to January of 2015. Next slide kind of talks a little bit about our goals when we work with organizations like yourselves. You know, the key is engagement and empowerment, and taking information that we can collect not only through Validic but through the other services that we provide, and administering health management programs that maybe are participatory based or outcomes based. And then of course the goal is to review these trends with our clients, evaluate healthcare risks, have a more engaged population, reduce risk, reduce costs, and I think that's the goal of what we're all trying to do collectively. Next slide. When we kind of entered our journey of integrating wearable devices with our platform, Fitbit had done such a great job with their guerrilla marketing strategy that we really reached out to them first and leveraged an API data feed with them. The challenge with that is it was only just Fitbit. It was costly, it was non-inclusive, and at the end of the day, really inefficient. When we partnered with Validic, it really proved to be a win-win situation because now we have access to over 150 wearable devices. It was cost-effective from our end. It was inclusive because now those individuals that were in our program that had maybe a Garmin, or were tracking their blood pressure or tracking their glucose, we could now engage those individuals, and it was very easy access to not only collect the data, but to get the data into our members' profiles. So it really became a seamless integration, and we've seen great results in just a short period of time with our partnership. Next slide. So what we did to try and make it even easier is a call to action for our members saying, hey, if you have a wearable device, sync it up with our platform, because then we can take that data, input it, and for employers that are rewarding or providing incentives for activities or trackers or challenges, all of that data can interface. The interface we have with Validic allows us to collect that data without any data entry for our members to do. And so then on the next slide, you can kind of see that our members can absolutely go to what we call the apps marketplace, which is really the partnership with Validic, and can give permission for those wearables that they're tracking to share the data with our company, and it's proved to be very, very effective. And the next slide really shows you just what 6 months of data that we collected has shown. Our members are syncing their wearable devices. It had gone from only 200 people to 5,100 people, and 20% of those folks had one or more devices, had more than one device. So we've got people that are really engaged in their health, and because we have access to all of the devices through the Validic platform or marketplace, it really did engage our individuals. And our members have logged over 4 billion steps, so you can kind of see the momentum that's growing. I think you saw it with Asset Health's presentation, Livongo's presentation, and more employers are really trying to engage their employees, and wearable devices are an important tool moving forward to help with that engagement. The next slide kind of is we've just recently, we have a coaching platform, and when we saw the success of the wearable devices just kind of on an activity-based, we really thought that we needed to weave that into our health coaching program. Traditionally, health coaching programs have some significant barriers, whether it be getting in touch with the individual. So what we did is we baked in the wearable devices to really increase that personal accountability and that personal connections with our coach. And when you wrap that into some of the other features that we have with our coaching program, with the self-scheduling, the smart goal setting, and the journaling, the device integration really completed that huge picture, kind of that global picture for our coaches to really have meaningful engagement and interaction with our members, whether they're being coached on weight management, diabetes, blood pressure management, hyperlipidemia, or anything like that. The wearable devices have really provided a great tool for our coaches to use when they're having those meaningful conversations. And again, the next slide kind of shows you that as a member, the member experience, we have the ability through our partnership with Validic to take in data more than just steps, the glucose data, the blood pressure, the water intake, and that's what makes Validic such a great partnership, is there are more and more devices coming on the market, and so we're able to access that through one provider, being Validic, and it really has added more meaningful and impactful data for our coaches to reach out to members. And the next slide just kind of shows you kind of what our member experience is. Our members are setting goals. I want to track my calories in my Fitbit app. I want to aim for 1,400 calories a day. And then on the next slide, you'll see that the coaches have access to that information, so they can actually see what they're doing. They have access to the data that we've collected from Validic. So if the member is wanting to do 10,000 steps a day, our coaches can go in and see how they're doing, give them words of encouragement if they're having a tough time. If we're working with a patient or a member who has hypertension and they're instructed to check their blood pressure through their wireless blood pressure cuff, our coaches have immediate access to that data so that they too can coach, reach out to them if there are some challenges or issues that are going on. So it really completes the picture. It validates the conversation that's being had, and it empowers our coaches to really focus on that motivational interviewing component to help drive the member to not only understand what their risk is, but to understand what things they need to be doing to better manage it. And so as you kind of go through the next couple slides, you can kind of see that what we saw in just a short period of time was the engagement level just really increased. Our engagement, for those who engaged initially with the coach, engagement went up from 39% to 71%. The average length of call went from 9 minutes to 17 minutes. And of those who completed the coaching program and the survey, 83% of respondents said they were very satisfied with coaching. Now that's a multitude of factors, but I do believe that because the coach has access to data, not only the self-reported data, but the data that we collected from Validic, truly empowers our coaches to have meaningful conversation, and that member sees that, so they feel as though it's really personalized and customized, which gives the greatest opportunity for health outcomes. So in the short period of time on the final slide, our partnership with Validic and the integration of wearables has clearly increased our member engagement. Employers are more engaging and looking for different solutions to get their employees on the move. It's really helped our coaches have more meaningful conversation. Clearly the challenges that we have, the health challenges that we have baked into our portal become a lot easier to administer when we can collect the data through the Validic portal. And it's just really opened the door to have more meaningful conversation with employers, employees, because we're all striving for the same thing: lower risk, lower healthcare costs, more productive employees. So just in the short year and a half that we've been partnering with Validic, we've seen a great impact and continue to look forward to it. So with that, I'll turn it back over to you, Jennifer, and thank you for everyone's time this morning.
Thanks, Mike, and thank you all for that insightful discussion. You all shared a lot of great points and examples of how wearables are fueling your programs and getting results. For our audience, if you haven't done so already, please take a moment to submit some questions that you may have in the Q&A box on the right-hand side of your screen. We've already had a number of good questions come in, and we'll have time to take a few of those. If we don't get to your question today, we will follow up with you directly on it via email. The first question that we have is directed to all of our panelists. What is your advice to companies that are looking to get started with integrating wearables data into programs? Mike, why don't we start with you? I'm sorry, Mike Demman.
Well, I think that to me the key is almost a crawl before you walk strategy. So if you really want to know what wearable device is going to have the most impact, I'd probably ask my employees to kind of look at the data that you have collected and then work with your employees to conduct a survey to see where you can make the most impact, because it is an investment. Start slow and then build off of that. But ask your employees what would motivate them and what type of programming would excite them, and then you can kind of decide what wearable is going to work for the organization.
That's a great point. Mike Creal, do you have anything to add to that?
I think it is a good point, and to add is to take the existing. So our world are typically wellness programming. So we need to drive the behavior change specifically around physical activity, increasing that, eating better, and if you can tie that data into your existing programs, that's going to be most effective, especially early on. That's the low-hanging fruit, and then you can look to other engagement or integration opportunities as you go forward, but that's the starting point.
And Jim, do you have anything to add about how companies can get started with integrating data?
I would just encourage everybody to look at the program that wraps around it, because data in and of itself, whether it's steps data, blood pressure data, glucose data, data in and of itself has very little ability to really move the needle. It's the programming around it, and so I would really encourage the folks online as they think about how to improve the overall health of their population. One, somebody said, find out where you can have the biggest impact. So not all not all data is created equal, and then look at the companies and the programs they've built. Again, we focus heavily on consumer experience, and really put that as well into the evaluation criteria, because activity trackers or glucose meters, whatever it is by itself, even well designed, won't produce outcomes unless there's a highly engaging, clinically weighty program that wraps around it.
Great, thank you. So our next question, this one can also be for everyone. How do you see employer programs changing in the future? Do you see a shift more towards disease management programs being offered in addition to fitness challenges? Jim, why don't we start with you on that one?
Well, clearly, we have a viewpoint given that we've moved into this space and are focused today on diabetes. And if you look at again where the costs are, the costs of things like hypertension, hyperlipidemia, and diabetes, it's a dramatic cost. You're not really going to be able to slow trend or reverse trend in your cost curve without bringing innovation to traditional disease management. So in addition to wellness programs targeted at a broader population, which a really good one has the ability to have, I think, a very positive impact. But in addition to that, I think the reinvention of disease management is a critical component to any employer looking at improving the health of their workforce while bending the cost curve. And so, Jennifer, to answer your question, the answer is yes. I think disease management, and the word is, I'm not sure I love even the phrase, but what folks think of traditional disease management, I think, will be still a big part of what's offered by employers going forward.
Okay, great. Thank you. I'm going to move to the next question. We've had a number of people ask some variation of this question, and it's one that we hear often as well. Do employees want to use wearable devices and have their data shared with their employer or with the insurance company? Let's see, Mike Creal, how about we start with you?
Yeah, so do they want to use them and have the data shared? I think the answer is yes. And you know, for the people that are utilizing them to, as we talked a little bit about, just using the activity challenges as an example, if I can make my life easier and I don't have to think about reporting, it just kind of happens and I can continue to focus on my activity, there's real value with that. You know, the landscape has changed over the years relative to, you know, I mean, when you're gathering a lot of this information anyways, and Jim talked about, you know, the diabetes glucose meters and sharing that information with the coaches. We have a lot of data shared with our coaches as well on the lifestyle side. People are used to understanding that information is going to be shared, and there's not too much of a concern anymore compared to even just a few years ago. So I think it's more of a let's keep it easy, let's integrate it, and how do I deliver more value to you as a participant through our programming, and that's where it's coming.
Thank you very much. So that is all the time that we have for today. We did have a lot of great questions come in, and we couldn't get to them all, unfortunately. But just as a reminder, we'll be getting back to everyone personally following the webinar. You can also feel free to contact us directly at hello@validic.com, and you'll see that email address on the bottom of the screen. And you can send us questions for Validic or for any of our speakers, and we will forward those along to them for follow-up. So thank you to all of you for attending today's webinar and submitting so many great questions. And I'd also like to thank our speakers for participating today and for WELCOA for hosting today's webinar. We look forward to seeing you all at future events. Thank you.